thank everybody for making it sunny here for me today, so I can rub it into my colleagues back on the East Coast that they're suffering under clouds and snow. At least I get snow and sun. I understand that this being a faculty lunch and student lunchtime dialogue, I want to make sure that I allow enough time for dialogue. So Marie's going to be helpful and give me the 10-minute heads up. But if I raise an issue and you really feel that it needs to be addressed, then please don't feel shy. Not that I think anybody as a social work student would ever feel shy. To raise your hand, and I'll try to pause and address questions as they come along, because I don't think there's anything here that I can't use my New York side of me to not race through in the end and cover all territory. So what I want to talk about is actually a lot about me in terms of my own research and how I move through research practice and social action, or at least the ways in which I try to make them all come together. Because as an academician, a researcher, and a social worker, it's truly important for me not to compartmentalize in such a way that it's this, that, or the other thing, and it's all coming together in one. And hopefully by the time I finish the presentation, you'll have a better understanding of how and why I take that perspective. I almost always begin a presentation on this issue of positionality, because I believe that positionality is crucial to understanding the work that you do. And what do I mean by positionality? How many people have ever heard the phrase, start where the client is? And if everybody doesn't put up their hand, then you're in the wrong place.
I'm looking.
That's right. That wasn't just a trick question. But starting where the client is, I don't believe anybody starts where the client is. Nobody. Nobody. You all start where the client is. We all start where the client is based on where we are. We are part of the equation. In order for me to be an effective interventionist, I have to position myself first. And that means understanding who I am, what are the factors that influence me. So while I began a presentation talking about snow in Iona or in New Rochelle, New York, that's about my position today. That's about where I am, because I've been up since 5:30 this morning on conference calls with people back on the East Coast. So a little part of me is really connected in that space and trying to decompress. And if you've ever been in a situation where something's gnawing at you or something that's there, if you don't own that, if you try to put it under a rock or something, it actually comes back in a worse way. And it's much better to address it and to let it go, and then to say, now I can move on. But this is just a definition, but researchers' reflexivity, and you can substitute practitioner or social worker, is really about being able to be in that intersubjective space. Being clear about where you are in that moment helps you to be clearer in the work with your client, with the work with your client system, because very often the things that we deny about ourselves, there's one seat left up here, the things that we don't like about ourselves are the things that will get in the way. In terms of further explaining the positionality, I've been doing HIV research almost since the beginning of the epidemic. First starting out not as a researcher, but just as a black gay man in America, sitting in a bar one day hearing about this kind of weird new disorder emerging in the 80s, and moving from subtle awareness to much engaged social activism, to intellectual curiosity, to research, to practice, to now being able to be involved in research paradigms and turning that into social policy. And I must tell you, I've had a very mixed and overall wonderful trajectory in this experience, meaning I've been touched by powerful moments in the epidemic where I'm old enough in the epidemic. I am older than I actually look. But I was in the epidemic when we still had to wear hazmat suits to go in the room with patients, where you actually had to put on and look like an astronaut going in. And I'll never forget the first patient I had to do that with. His name is Freddie, was Freddie, and he comes to mind almost every time I do a presentation. And it was in that moment in space that I realized I had to take the gloves off, literally take the gloves off, because I was scared, he was scared, and it wasn't helping anybody, because the humanity was not being addressed in that moment in time. So again, the positionality for who I am, I share with you because it shapes everything that I'm gonna come at you with for the rest of the presentation, and it also helps you to know, why am I spending 50 minutes with this guy if I don't know a little bit more about some of the things that make him tick in terms of his worldview. So it's a bit of a selfish thing, but it's also really about me sharing with you some important landmarks in my own career. And so again, as we go through the day, the 50 minutes, if there are things you want to know about any of the prior research I've done, people who have funded me, practice experiences, happy to share those. Let's talk about social work. None of this, just like the person and environment, comes as a surprise to any of you. One of the benefits of social work is social work does just about everything. One of the shortcomings of social work is social work does just about everything. And we're on both ends of that conundrum because there's so much fluidity in what we do. It's not like being a specialist in one area, because even if you practice in one area, for example, if you are focusing on individual client interventions, you're thinking about policies that affect the client, even if you're dealing on the individual basis. If you're doing policy, you understand the implications for the individual. So the person and environment influences, but we're activists, educators, coordinators, researchers, group facilitators, speakers, negotiators, mediators. We do all of these things and many more. Oftentimes, we're filtering and doing these almost concurrently, if not simultaneously. When we're educating, we could be advocating. When we're researching and group facilitating, we could be speaking, things of that nature. So it's a very complex arena. Another thing about my background is that when I was an undergrad, I was really clear about what I wanted to do. Some of you will have no context for what I'm about to say, so you'll have to ask me or get somebody who's over a certain age to define what this means. When I was coming through, I wanted to be a physician, but once I went to medical school, and when I got to medical school, I really realized I wanted to be Marcus Welby. And see, I can tell, most of you don't know what I just said. So some of us, and we'll talk, Google Marcus Welby, not now during this presentation, but later, TV character. But Marcus Welby could solve every medical issue in those 45-minute time zones. I hated medical school. Wasn't that I hated science, but I hated focusing on just a narrow part of the person. And I realized over time I was much more interested in this. So well before don't ask, don't tell. So what do you do when you leave medical school? I joined the military. Right, well before. And I can tell you some stories about being in the military, but we won't go into those right now. It was a good formative part of my experience, and I was very proud to have served our country. Social work, given all of those things that we do, oftentimes people ask me, why do I get a social work degree? What is it that you can do with a social work degree that I couldn't do without it? Another way this comes up sometimes is we tell people we're going to college or we're going to graduate school, and the family says yes, and then it comes down to the major, and you say social work, and they go, what? They look at you, see? Somebody else has had that experience. And here's some tidbits for you. So we have to recognize the value added. One of the things that often doesn't happen in our own profession is that we don't spend enough time articulating the value of what we bring to the equation of addressing the issues we're so busy doing. And in the doing, sometimes we don't step back to articulate and to be able to capture the nuances or the language of the value added. And notice when I say value added, I'm not just talking about the monetary value added, although I can argue how we have monetary value. I'm talking about value on many levels. The recognition of the way in which we intervene and produce precise outcomes. Being able to clearly articulate the relationship between your interventive activities, the steps that you take to integrate those and apply them systematically with client systems, individuals, groups, families, or large systems, to be able to evaluate those, to be able to quantify the interventive steps, and then to relate those to specific outcomes is a core part of what we have to be able to do. And I feel that over the years, I've had the privilege of being able to be in spaces where I have been forced, literally forced, whether it's in writing for a research grant or a manuscript or competing in spaces with colleagues from other disciplines, I've been forced to grapple with what is it that I mean by my language, and what are the interventions, and how am I making sense of that for other people in the world who don't see just my value structure. It's easy to talk to other social workers and we nod our heads and say, yeah, we all agree, but then we leave the room, the question still rests, what difference does it make? And what difference did it make, especially for our clients, but also to individuals who don't understand or necessarily don't agree with the political, economic, or social perspective that we bring to the table. So our value has to be articulated in innovative ways of outcome-informed practices. Outcome-informed practices. I didn't say evidence-based, although that gets us into a whole different conversation, but outcomes-informed, because when our clients come to us, they're looking for outcomes. Whether those outcomes are reunification, substance use, connection to resources, they're things that they're looking for. How did we do it? Did we do it by chance? Or did we do it through a systematic application of steps that are connected to the learning that we do in our educational experience? And that goes back to that question I said I posed, and we got some reaction here when our family asked, well, why do you need to get a degree in social work? It's because this is not something that you do without training. This is not something that is not based on a body of theory and knowledge and draws from multiple disciplines. It is really about an informed practice base. And so when we think about what we do, and when our friends and colleagues say, well, social work, all you do is help people. Well, yeah, helping is a critical part of it, but there are particular ways in which we approach that with the guided intent of producing clear outcomes for the systems that we're engaging with. And we have to be able to monitor, measure, and then in instances where we need to modify that. And we have to validate our indicators. And then we get down to words like cost and cost savings. We have to be able to show how doing things and having a social worker in that space has a cost beneficial impact on not compared to not having a social worker in their space. And because I'm short on time, I can't do all of that discussion, but I'm happy to talk about it in our question and response. But I thought for this discussion, a bigger thematic question is, okay, given what you said, Darrell, do these approaches help us to address social justice? And what might this look like in a U.S. divided? And I'm not talking about a U.S. divided just on political ideology, or racial, or gender equity. It's all of the above. We are a divided nation. We are torn apart because of many elements that have to do with social justice, economic justice, racial justice, or if you'd like to put injustice in front of any of those, you can, or disjustice, educational justice or injustice. We know that our educational system is not equitable for all individuals. Different school systems based on tax valuation have different kinds of resources. How people come into college looks different for individuals who have had access to certain types of educational benefits. Geographic resources, whether you come from urban areas or rural areas or near urban or suburban, or whether you come from highly densely populated, culturally inclusive and diverse communities, religious justice or injustice, environmental justice or injustice, how you receive your water, as we saw in Flint, Michigan a few years ago, is really about equity and justice in the environment. When I was coming up, environmentalism was, loosely connected to tree huggers, as we would call them, and it was a different moment in time when it was harder to. But over the years, we've gotten more savvy about the relationship that we hold to this thing called the planet Earth. And recently, the federal government put out a very large interdepartmental document. It's about 1,600 pages that really paints an interesting picture for the next 25 years on this planet. And if you haven't read it, you can Google it, but it's an interdepartmental federal government document that in your spare time and you're reading between class assignments, 1,500 pages between gender justice and political justice. And political, I could almost put the capital P and the lowercase p. I'm not talking about capital P in terms of political party, although political party justice and injustice may be there, but I'm actually talking about lowercase p, which is the political processes, even access to politics, who gets to vote, who doesn't, who has understanding of resources and is able to engage, who has information. And as we saw in a recent election cycle, and this is not being partisan, so I'm not pushing that, but I think there's broad acknowledgement that there are ways of tampering with our political system that have to be addressed in a just political society. And so these are the kinds of issues that social work is engaged with. And so justice and liberties combine, but there's also the issue of responsibilities. And I like to put in the responsibilities part because I don't believe that you can have justice and liberties without owning the responsibility that you have. It's kind of like drawing out of the ATM from my bank account. At some point I deplete the bank account if I don't put something back into it. That the responsibility is to continue to replenish, to give back, to be a part of the solution, not just to be someone who stands on the opposite side being angry about something. What do I offer as meaningful contributions to this and to any of these and others that I might have as my connectedness? When we talk about disparities and inequality in the LGBTQ, and this phraseology, as many of you know, continues to grow all the time. I am totally confused by some of these words. I could tell you the words that we were called when we were growing up. Wasn't queer, there wasn't a popular terminology, but when we look at these, and why is it important to me? One, on a personal level, it's very important because it's my life, but it's also important because these issues have many population intersecting identities. Gender issues and gender equity, wherever you fit on the equation, has to be part of a discussion that social workers hold because everybody doesn't have the same access. You know, in this society, all access is not the same. 40, 50, 60 years ago, some of the elements of this equation look different, but some of the issues were absolutely the same. Access to reproductive health, access to equitable gender-based health care. You go back even further, and let's go back to what is historically called the Founding Fathers, and I always think that's an interesting narrative when we talk about the Founding Fathers. Where were the Founding Mothers? They're not usually talked about in the equation. There's a gender-based dialogue that's even at the core of our historical understanding. And as many of you have probably heard, when we talk about history, his story, what about her story? History, H-I-S, his story. What about her story? We don't talk about these kinds of things in a fluid narrative. So when we talk about disparities, when we talk about inequalities, when we talk about social injustices, they are baked into the fiber from which we have all been fed from the beginning of the American experience, from the earliest days, where the equity was not guaranteed to everybody, and who gets to tell the story is a critical part of it. So part of what we have to be able to do as well-educated social workers is we have to be able to disaggregate the difference between a real nice fluid story about, pilgrims came to the country, they invited First Nation people to a wonderful Thanksgiving meal, they all sat down and had a good time and went home and ate pumpkin pie. I don't think so. So that's not the reality, and we have to be able to have those uncomfortable discussions if we're going to move forward on these issues. When we look at the kind of research that I do, we knew there wasn't a solid base of HIV research. As I said, I've been doing this for a long time. In the beginning, there was only trauma and fear. There was no research. People were dying, people were scared, and people didn't know what to do. looks very different today than it did 35, 40 years ago. And there's still stigma and discrimination, but one of the things about the term stigma and discrimination, oftentimes it feels like we're looking through a microscope from the wrong end. Have you ever, remember if you've ever taken a science course, you look at a microscope, you look at something that's very small and it makes it look big? What happens if you look in from the other end? Something big can look very small. A lot of times stigma and discrimination research and approaches are taken in a way that help people who are being stigmatized and discriminated to be accommodating to the forces of oppression. And the stigma and discrimination social agenda really doesn't attack the oppressive forces. What it does is help people who are experiencing the discrimination to integrate a reality of how either, and sometimes very subtly, how they are part of the problem, and if they only become more like the American dream, they would then fit in better. And by fitting in better, then you wouldn't have the same problems. So with LGBTQ individuals, if you would just act normal, then you wouldn't be treated the way that you're treated. And what does normal mean? In a society where normal is defined by the group that holds power, and who holds power at any moment in time and in any space may shift based on economics, race, class, education, all those things. And if we don't understand that as social workers, we kind of go into the dialogue assuming that normal is normal. If I speak another language, is that not normal? Well, I guess it depends on where you are. I was just in Italy over Christmas, so speaking English could be considered not normal, but it's very normal for me. So when I go into a restaurant and my little bit of Italian got me in trouble and folks thought I could really speak Italian, I had to say, time out, please, because I don't know what you just said. You know, that was, you know, defining normal becomes a very interesting thing, and that's why I talk about positionality, because my inability to speak that second language was my issue, not when I'm in a different country or culture, because that's the norm in that space. Intersectionality, don't have enough time to go into all of it, but intersecting identities really is a different way of seeing all of these differences and to recognize that, and I use myself a lot, Darrell P. is the amalgama of his ability, status, education, religion, income, gender, race, and you can put as many of these things on there as you want, but if you take only one of those things, you miss something else. And where I sit in my life, in my world, is the intersection of all of those, and it's done over a life course. So where I was as an intersected being 30 years ago, 30 additional years of life lived will affect how I see the world. So when we're social workers, we can't assume that just because I know what your key component identities are, that I know how they all come together and how you now integrate those into how you see the world. Nor can I assume that you as an interventionist, as an emerging social worker, just because you've read a book by you've read a book by some individual sitting in the room, that everybody got the same message from having read those pages. It really is important to take time and to take stock and to ask the question, how do all of these pieces fit together for you, for each of us, in making us who we are and how we see the world? So I like this one. I recently got invited about a year ago. I don't do sleep research. I got invited to a sleep researchers meeting. I didn't know if they invited me because they wanted me to talk so they could go to sleep, or if they wanted me to come and offer contribution in some way. But what they really said is they wanted somebody outside of their normal research group to talk about research that could ultimately be incorporated in research. So this piece comes from a little bit, and understanding, for example, in my own research now, I've begun to think about this. How does the stressors or issues that might be faced by LGBTQ people fit into their cognitive, emotional, behavioral, interpersonal spaces, and how could that affect sleep? just another way of thinking of the world. So when I'm talking about how my worldview and my intersecting identities change, I never thought about sleep before with the communities I work with. I thought about HIV prevention, or I thought about HIV intervention. I didn't think about it in terms of sleep. Now I'm going to go into a few slides and then hopefully on to Q&R about some recent research that I've been doing, and it's related to the use of a medication to prevent the acquisition of HIV and AIDS, and it was focused on African American men, and an article just came out this week in a Journal of International AIDS Studies that we published that shows some really promising outcomes from this intervention. But it really is, I hope, an underscoring of how data can become action. In HIV research, if you're not treated at a particular point in time, the average life course, if you were infected at age 20, is you're probably going to live about 12 years, even today, if the disease progresses. There are some people who are known as non-progressors, but just on average, it's about 12 years from the time of infection to something serious can occur to you. However, if you're HIV negative, your normal life course for an African American man is about 79 years, but if we can get you on treatment, you can live up to about 71 years with medication. So the difference between 71 and 8 is 8 years still, but that's a lot better than 32 years old, correct? So there's a real biological benefit for getting the medication. But what we saw in the real world, that even though these medications were out there, they weren't getting to people who were disproportionately impacted, particularly African American and Latino men who have sex with men, and that they were at risk of dying at a much younger age. So our research was both about the medication and the benefits. Once you took it, does it really help you? But what were the ways in which we could help you get it? We did a study in 3 city locations. It was a relatively small study by the N standard, but it was a really big study because when we started this study in 2014, it was the first study focused on Black men in the United States in HIV medication use. Other thing that I have to say, in the 30+ years that the US federal government from the National Institutes of Health have put money into HIV prevention research, when they funded this study in 2014, it was the first time a US Black man had ever headed a protocol in that entire, and that was me. And it was shocking because, well, thank you, but it was shocking because we were writing papers and research about the disparities and watching the disparities happen, and a group of activists, men said, stop this boat now. You're studying us and we're not at the table to engage in the research, and you can no longer tell us that we're not smart enough, we don't have the credentials, and if you try this one more time, we're not having it. And it really took that activist approach to get somebody at the table, and this is where privilege comes in, and I own my space in privilege. I happen to be at a point in my career where the privilege fell to me as well as the responsibility. Remember we talked about responsibility? I had to step up or shut up. I had to step in and be willing to risk that I could do something wrong, but I couldn't hide behind the fact that that folks were not encouraging me to take this on, so we did. We had a wonderful study where we brought men in, we offered them Truvada. We did we actually began in 2013, not 14. We were fully enrolled by 14. We had 226 people enrolled. We wanted to especially see about the benefits for men under the age of 25, and we had overall retention of 92%. Anybody who does research and you see numbers of 92 to 100% retention over 1 year, yeah, you see the nodding? The folks at NIH, not only did we have 92% retention of men over 1 year, I was the protocol chair. There was a Black gay man who was the protocol co-principal investigator. the behavioral interventionist was a black gay man, and the developer of the intervention was a black gay man. They wanted to know, we got called to so many meetings asking us, was this a real number? Was this actually happening? They wanted to know, how was it that you were able to get people to stay in a study and to take medications at that rate? We're still holding on to some of the secrets, but the reality, and they're not really secrets, it goes to what we call indigenous knowledge. Each of you, positionality, each of us holds indigenous knowledge that is unique to an experience that we have in the relation to others who might be like us. Whether that's based on culture, language, geography, there are things that you just know about being a woman that you can look to another woman and know that a man will never know. There are things that you know about being a Colorado State University student because of the experience that somebody else won't know. That's indigenous knowledge. And so we use that knowledge to help inform the intervention, which we called C4, Client-Centered Care Coordination. So those of you who've been around intervention research, client-centered is not really new, but the way we packaged it really brought the man into the forefront of the research, as opposed to just saying take a pill. We said stop. We want to understand your life. What are the forces that affect your life before you make a decision to take a pill that could benefit you, but we want to know what could stop you from taking the pill, and we develop services around that person to help them to be able to make an informed decision about when or if they would take the pill, as opposed to coming at it as, you're a bad person if you don't take the pill. That's one of the successes that we got, because we weren't peddling a pill. What we were doing was elevating the humanity of the man. And that was the big secret. And we also made sure it was connected to the community as well. Had wonderful outcomes, as I said. My last slide, I think, gives you the reference page to it. So again, in addition to the 1,600-page environmental study, if you want more reading in your free time, you'll have a link to reference. And I'll leave the slides with Marie or with Paula or somebody, anybody, share all the information here. We had lots of men who took the medication. We had very few seroconverters, meaning people who became HIV positive. So we needed to show that it had benefit, and I think that did. But what were our lessons learned? You could tailor an intervention that would have benefit, and you could substitute other groups here, not just Black MSM, because we believe it has other relevant community elements, that because of the membership of who we all were, using our indigenous knowledge, we were able to create an intervention that was particularly useful. And I would say that everything in our intervention was driven by the core principles of social work practice, starting where the client is, where you're capable of being, connecting to the community, understanding the person in relationship to an evolving historical narrative, understanding the biopsychosocial components. All of that is social work. And we were able to show, remember that earlier slide about the value? We're at the point of demonstrating the value of this intervention in a biomedical setting. There are still challenges. We have issues of continued health quality, what happens to people outside of HIV, higher rates of unemployment, issues of incarceration for the populations that we were dealing with, continued stigma, men who were not aware or afraid of getting their status, issues of complacency, complacency meaning I don't care, my life isn't going to amount to much anyway, so what difference does it make if I become HIV positive? We had to grapple with that. Again, some of that's related to many different worldviews. And then just overall the higher prevalence. We didn't set out to change the world. We set out to prove to demonstrate some very important elements in our research agenda. This slide, I think, goes to an important element that I want to drive home in my last few slides. Sometimes we talk about equality, and we know that equality is where everybody gets the same kind of lift, but everybody doesn't start at the same place. If you're 3 feet tall versus 6 feet tall, just giving you a 2-foot riser doesn't help you look over the fence. Well, Equity says, well, I'll give you a little bit more, but liberation asks you, well, why in the hell do you have the fence in the first place? Who are you trying to keep out by putting the fence there, and what is the purpose of the fence? And maybe I shouldn't use fence in this day and age, but I'm really not, that was not a political statement. It was not a political statement. Real time, I had to own it. I realized I was saying I'm being taped. I didn't mean that as a political statement. You see this cartoon, there is that thing there, but the question is, what is the fence intended to do? Was it intended to assure that only people who played could get paid could get to be a part of this? Or is it intended for some other reason? But we have to ask the question, why do we have the barriers that we have in the first place? Because that's a fundamental question about how we're addressing it. And so even if you do equity-based agendas, you haven't addressed the barrier component of it, and that means that the barrier could just be raised to undo the equity. You know, there's a simple fix if that's not the real problem that's being addressed. Not a political statement, I guarantee you. So in closing thoughts, I hope we develop a critical strength and asset discourse on race, gender, all of those things, education, all of the things that I put out there. We have to have an assets-based approach. Social work value, right? When we talk about asset-based orientation, it's not always about a deficit-based. What are the things bad about you? But what are the things that I can harness to help you advance that are your strengths? It could be your language, your ability, your cognitive skills. It could just be the fact that you woke up today and got out the house and overcame an adversity. Any of those things could be an asset. There is a lack of self-directed social, political, and economic spaces for many people, and I meant to bring it with me, and I forgot to bring it today. In yesterday's New York Times, there was a wonderful story, and it's on page 13 of section A. I'm a numbers freak. It's on page 13 of section A of yesterday's New York Times, and the story is about lynching of Mexican Americans. Did you see it? Yeah. It's a wonderful story, yes. And not in terms of 2019, but at the same time we were seeing lynchings of blacks during Jim Crow and slavery periods, talking about, got it, I'm at top 10-minute warning, and I think I have one more slide. So if you get a chance to read it, look in yesterday's New York Times. But it concludes with something I believe in profoundly. Who gets to tell the story is a critical component. And I think like the final sentence in that article is, who gets to tell our story? And the woman who is the article is about is a Mexican-American descendant of one of the men. It's her great-great-grandfather who was lynched in a massacre situation, and how, as an adult, she's uncovering these components, and she's concluding that had it not been for an incident at a family funeral, she would never have known that, and she wouldn't be uncovering this story today and telling this story. And then we have to have in my own research, we have to continue to critique HIV in relation to other healthcare needs. But it's not just about HIV prevention, as I hope you heard me talk about. It's about a social action agenda. As a social worker, as a public health social worker, I'm very glad to be involved in what I think is meaningful research that will help individuals to prolong their life and hopefully to have a quality life. But it is equally important for me as a social worker to be engaged as a social activist scientist, to use the capacity that I have to speak, to write, to engage at policy meetings and other spaces, to push the agenda, to push the envelope of comfort around some of the spaces where people sit and ignore other historical factors. And I think that was my last slide. I'm gonna leave that up there if you wanna snapshot the picture so you can read that article, not just self-promotion, but because I didn't get a chance to talk about the research, but on yesterday's New York Times, page 13, section A, find that other phenomenal article. And with that, I thank you. And I'm happy to answer questions. But I know I try to throw a lot out there and cover a lot of territory. and this is a dialogue, so please throw something back, or not throw, don't throw anything literally, but if you have comments, critiques, questions.
We still have 8 minutes, so please, questions, this is a good time.
Yes.
So with the State of the Union address, President Trump mentioned his comments about combating the HIV issues that we have in America, and I know the CDC made a statement about that the week after or the day after. I'm curious if you've heard of any initiatives or new funding that are going to be taking place from that, or how you feel about that.
I wish policy worked that fast.
Yeah.
Everybody heard it, starting with the prior president. Actually, no, starting with George W. Bush, when we got PEPFAR, so it's not a partisan issue. The past 3 presidents have done significant, including this president making that statement, so there have been things done. It's a momentum. It's very interesting he would say that, because at the moment the new administration came in, I was the vice chair of the National HIV Council, and he disbanded the council. So, I need the action to follow the rhetoric, but as far as the research community goes, it may help to lead to research administrators earmarking funds that could come to this kind of work. So I think that there is a shiny lining there, and as I said earlier to someone or to a group, I try to be an optimist at the end of the day, otherwise it's just too heavy not to be. So I try to find that positive, and that would be the positive, that something good can come of that. But administrators are there, bureaucrats are ready to seize that moment and move money. Other questions? Even if it's just about me, and I'm happy to answer those questions too. Nothing? Yeah, go ahead.
You mentioned that you were in medical school for a little bit. For those of us who are almost done with our ACSWs and don't really want to go to medical school, do you have other pathways into getting into research? I mean, hard, quantifiable science and policy changing research.
Okay. Well, pursuing a master's or the doctorate in social work, social welfare is one, because the science of our own discipline is ever evolving. So you should not exclude the master's in social work or the doctorate in social work, or Ph.D., because the rigor is there. I also hold a degree in public health. So personally, I found and I know you have a dual degree program. So I have a wonderful experience between the worlds of public health and social work. It's a very strong and integrated fit. I have colleagues who have married their social work degree with sociology, psychology, health policy. There are any number of ways. But one of the things I've noticed that my colleagues who've joined those degrees, social work with something else, they still have a different way of approaching problems than people who only have the degree in that other discipline. And so while we ask the question about can we be more quantitative or methodologically rigorous, all of that is great, but if I do a wonderful paper and quantify and don't do something to action, the question for me is, did it really mean anything, or was it just about me getting a paper published? And I believe that one day we all pass through what's called this life into some other life, whatever you consider that to be. And at that moment, I'm probably, I always say, when I was a doctoral student, if I get to the pearly gates, St. Peter's probably not going to ask me how many papers I had published in Tier 1 journals. That's not going to be the big question. And so I think that whatever we do, whatever you do, it has to be married with blessedly, it will be with some passion that you have about a cause or a set of issues that you're making an impact on. And when I say blessedly, I don't mean in the Christian way, but I mean as a real kind of selfish blessing. It's a great thing to get up and do something that you believe in, and that it doesn't feel like an arduous task of work every day.
Thank you.
You're welcome. And I know everybody's got classes, so thank you very much for your time.